So I want to dig into that intelligence piece a little further and talk about how trusted data really enables that. So if you do anything online, you have a social graph. Amazon knows how you are related to every product, every user, and every purchase. They know exactly what to suggest to you and exactly when to suggest it. Facebook and Google do the same thing. They know how you relate to every other person and every advertisement on the platform. So all of these are versions of social graphs, and every major tech company has a social graph about you. The problem is that social graphs have a pretty negative reputation since they've been used in a lot of really intrusive ways. But the underlying graph models and the graph theory that they're based on is actually really, really useful. So in the healthcare industry, graph models have enormous potential to do good. The shift towards value-based care has really pushed the industry to find better ways to optimize. And that means getting much deeper insights about their system and the people in their system. But in order to do that, the industry needs to combine medical data with all sorts of other data. So behavioral and social data, IoT, genomic data, environmental, on and on and on. There's a lot of activity in this space. So all of these areas that you see here, these are areas where we are seeing interest in using graph model technology. And the implications are really huge. The ability to predict what treatments will work best for a person based on this deep understanding of who they are, that's a game changer. And if we apply graph modeling on the operations side, it makes it a lot easier to really truly understand what's working and what's not working and why. So up until recently, the tech industry has been able to gather and use all this data without really a ton of oversight, which is obviously a problem. The healthcare industry is definitely a different story. There's a lot of fragmentation and rigidity when it comes to how the industry handles data. And that makes it really hard to apply graph models to health data. The problem's about to get even more complicated too, or it's already complicated, because we're in the middle of this big push to give consumers more direct control over their data. So both the tech industry and the healthcare industry up until now have largely operated on the assumption that the company owns and controls the data, not the consumer. But now these new regulations are forcing companies to rethink how they manage data. So all of a sudden, security settings aren't enough. You can't just put up a page and say, choose your permissions. They have to provide people with real control. And likewise, encrypted databases aren't enough. They have to think about where people live and where they have to store their data based on that. So everyone's trying to figure out how to handle these new regulations while still maintaining the value that graph modeling really provides. And here's where trusted data gets really, really powerful. So trusted data carries with it all of the security and context, as we talked about. So you can incorporate a trusted data or multiple pieces of trusted data into a graph model and create essentially a trusted graph. So we call these life graphs. A life graph can include data that may be owned by lots of different people or companies, and the data doesn't even need to be located in the same place. So as an example, I own my health data and it's part of my life graph. My doctor is also part of my life graph. So her professional profile is also part of my life graph, even though I don't actually own that data. So trusted data is what really allows these graph models to operate within a new regulatory framework where data lives all over the globe, it's owned by all sorts of different entities, and it changes all the time. Trusted data allows graph models to incorporate that. The net is that ownership and control is going to shift from the company to the person, and privacy is enforced automatically within the system. So even if that data is being created by my doctor in an EMR or by my Fitbit device, the ownership of that data doesn't need to default to the company. It defaults to me.